Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And this is the time of the year, I guess I don't like to date these shows, but we talk about safety, but particularly we want to talk about holiday safety and travel safety. And I figured, you know, we have a wonderful West Side on campus. I don't know what the actual title is of West Side Regional Emergency Room on campus at Nova Southeastern University. And I figured, why not talk to the people who see these events or the occurrence of people who unfortunately have had problems with safety. So let me introduce to you Dr. Caroline Vera,
hello,
who is an emergency physician. And where were you educated?
I am from Nova.
You are?
Yes, completely.
My goodness gracious.
Undergraduate medical school.
So, see that? What a surprise it is to me. And we have Vanessa Maloney, who is a RN, a nurse professional with a baccalaureate degree. And she also is a local person.
Yes.
And she works at Westside Freestanding, that's the word, Freestanding Emergency Room in Davie on Nova Southeastern University campus. And she works with Dr. Vera. Welcome.
Thank you.
Caroline, good to have you.
Thank you.
So I have two local folks. It's good. Holiday safety, travel safety. Big issues. People just sort of say, oh, it was just an accident, it was an odd thing, etc., etc. Let's talk about safety. Dr. Vera?
So it's not just the holiday season, but it's also the season, as we call it in the ER, because we see so many instances and cases of issues with safety. I think starting with Thanksgiving, the biggest thing we see is turkey fryer burns. So we want to definitely make sure everybody knows how to use their fryer properly, follows directions, so you don't end up seeing me in the coming weeks. The other thing that we worry about, of course, is there's going to be a lot of cooking, so a lot of knives laying around. So we see a lot of lacerations from the adults as well as children. So I urge the adults to keep the knives away from the edges of the counters to keep the little ones safe. And then the other thing that we see a lot of is allergic reactions. So I think it's a good idea to know your guests, know their allergies, keep a first aid kit available, and if possible, maybe an EpiPen. It's never a bad idea because you never know with all the yummy foods that we're going to be cooking in the next few weeks.
That is true. Vanessa, may I call you Vanessa?
Absolutely.
Okay, Vanessa. You know, it's not only holiday safety that we talk about because,
right.
You know, you guys are on service 24 hours a day over here at the freestanding unit in West Side Region, which is over in the shopping plaza just south of the Nova Southeastern campus. It's on campus, but it's just south, right here on University Drive. But people come in with all kinds of accident issues.
Right.
So let's just talk about what you would see. Particularly, there's a lot of travel that goes on because, you know, the state of Florida sees so many people that use vehicles, whether they're regular, you know, everyday cars, or whether it's RVs, or whether it's specialty units that they use. But they do a lot of traveling on our roads. Let's
right.
talk about holiday safety.
Yeah, definitely. I think it's really important, obviously, just the basics, wearing a seatbelt. Traffic tends to be a lot higher during the holiday, so you see a lot more influx of accidents. So just the basics, wearing a seatbelt, carrying a first aid kit in your vehicle is super important. Not texting and driving is very, very relevant. Obviously, with the holiday, you don't want to have copious amounts of drinking or anything involved. You want to be really focused on where you're going, and you want to be cognizant of your surroundings.
Let me suggest something to you, because this was part of a show we did during the summertime. But during the show that we did in the summertime, about drowning. I mentioned in that show that it's very prevalent for accidents to occur during holiday times, particularly in the wintertime around the Thanksgiving, New Year's period, all right?
Yeah.
Now, we don't want to blame people for using a wonderful word, copious drinking, but there are people that, you know, 1 or 2 drinks might cause them to be a little unsteady, or maybe
There's Uber and
right.
there's other methods, you know, you just have to know what your outlets and your resources are, whether you use a taxi or Uber, or I think there's a new system called Lyft, and, you know, anything, even somebody at wherever you are, just a designated driver, anything like that, just pre-thinking things through so you can have a good time and just make sure that you're safe about it.
And we have more pools in Florida than any other state in the union, and we have a lot of waterways, we have the beach, and therefore we have the largest number of drownings
Right.
of individuals in our state.
I think it comes down to the basic form of communication. I think when we're having large parties at our house, it's very easy for everybody to lose sight of who's watching little Johnny, that he doesn't go into the pool. So I think the basic thing to designate an adult, like, you know, for the next hour, you're in charge of making sure that you know where the child is so that they don't end up in the pool. And then, of course, the fact that you need to have a pool fence. But I think it comes down to just basic responsibility, communication, and knowing where the children are at all times to avoid drownings.
You know, I just want to get back to some of the very basic issues, which, you know, it always occurs within a household. Burns, cuts, trip and falls,
Right.
all right? Accidents, people are cut by glass. They fall through a window or
Fall off a ladder.
fall off a ladder. Talk to me about some of that and the presentation into your freestanding unit at right here in Westside.
I think people should know their limitations. We get a lot of people that shouldn't be on ladders getting on ladders. So I think that you should know if you're physically fit to do that. Make sure that you have a nice, even surface to put a ladder. Electrocution is another thing that actually occurs. Not as often as other things, but we need to practice safety and make sure that all the power cords are not exposed, that they're appropriate, the extension cords that we use are safe. Animals also can, I've heard of cases where they chew on the cords and they expose the cords and then you get fire. So it's always a good idea to have a fire extinguisher readily available, know where those are in your house. But yeah, we definitely see a lot of lacerations. That's probably the most common thing. I think people are stressed, people are in a hurry, and they're just careless. Things happen. So a first aid kit is a great idea to have around, like know where it is, maybe keep it out so that you can anticipate any of these things that could potentially happen.
And Vanessa, you mentioned something, and it sort of slipped by when you said wearing your seatbelt.
Yeah, I mean, sometimes I really feel like it comes down to accountability. It's really easy. I know, being a mom, I have 2 wonderful little girls, and it's so easy to be tired because you just, you know, you work and you're taking your kids this and that. And I feel like it's so easy to just say, just sit in the back seat, just, you know, sit down. But the thing is, it takes the 5 extra minutes just to strap them down and buckle them in, just to assure their safety. And I think that what you did was a fantastic thing. You know, a lot of people commonly do these things and you see them, but because of the way things are, sometimes you don't want to roll down your window because you don't want to get involved, not knowing what the repercussion might be. Ultimately, you had this fantastic outcome, which is wonderful, but I think accountability is a really, really big thing, you know? You take the initiative to get into a vehicle and you take these tests and, you know, you agree that these are the things that you're going to do. And it's not just to be restrained, I guess, in the sense that, oh, I don't want to wear my seatbelt, or I do. It's just a matter of protection. And I think that that's why we have these laws and we have these things in place. And it's, again, something that it's just so easy to just, I'm going down to the store and not put on my seatbelt, but it's so relevant, especially when it comes to children too, because they don't have the choice. They don't know that they should be doing this. You know, these are things that we instill in them. So I think it's really, really important, and accountability, and it's just paying attention and just thinking about the future, which sometimes we don't think about. You know, we're just worried about the here and now instead of the tomorrow.
When a child is born, they leave the hospital with a child restraint seat.
Right.
Correct?
With training.
Right.
Yes. They don't let you leave without seeing the seat and watching you put your child successfully and properly in the seat.
And most people do not realize that most accidents that cause harm to the body occur under the speed limit, the speed of 30 miles an hour, under the speed.
Yeah,
somewhere around 26, 27 miles is the speed. And the child becomes a projectile. Yeah. So the essence of your profession, or I say the realization of telling them about putting their child in a safety seat, is no different than talking to them about wellness, about, you know, cutting down on your intake of sugar or salt if you're hypertensive. Am I in the right area?
Absolutely. I think that education's important, and there's always the chance to educate a patient in any kind of setting, whether it's primary care setting or the emergency room setting. As far as seatbelts are concerned, it's the law. It saves lives. It's proven to be something that works. So why would you not want the best for your child? So yeah, we always find ourselves, teaching patients and recommending certain things for generalized safety.
There are issues relative to, and I was just about to talk about, and I don't know, I would like your professional knowledge in this area, but there are people who do relate to holidays, particularly Thanksgiving and Christmas. They remember the people who have passed on. They relate to the issues that perhaps were emotional. They were emotionally compromised, maybe distressed, maybe even in a state of extreme anxiety. Do you see much of that at the or
all
do you?
The time.
Yeah.
I think stress, depression, and anxiety are a big presenting symptom during the holidays. I always tell people, give yourself extra time, avoid road rage. So the holidays by nature, unfortunately, bring out the ugly in people sometimes. And we do see a lot of exacerbations of anxiety and depression during those times. I recommend that you give yourself plenty of time, try to relax, try to remember the basics of what the holidays are about. It's not about the gifts, it's not about having the best dinner, it's about enjoying a good time with your family, friends, and loved ones. So I think that's important to remember and kind of bring it back to basics.
Vanessa?
And know your resources. There's tons of places out in the community that if you need someone to talk to, if it's something that you just can't mesh with, for sure that there are resources in the community, and we're more than happy and forthcoming if you need anything. Obviously, the emergency room doors are always open for any type of need, whether it's a mental, an anxiety, a depression, anything versus a physical cut or a wound or anything like that. We're always there to help anyone in need, even if it's someone to talk to. We may not have hours and hours to talk, but we most definitely have the time to lend an ear and help with guidance or
direct them to the
right
place.
Even for resources.
Yeah, well, that's the beauty of having these self-standing units. I think that people have a tendency not to, and I can understand that. Hospitals are hospitals, and they're the magnificent places to deal with the tragedy of illness, pain, things of that nature, which are long-standing often. Sometimes they're immediate, I mean, no one knows. You get the onset of a cardiovascular issue or something of that nature. But to know that you have these freestanding units in a community is really a wonderment to me. To me, it's a place of comfort. That's the way I look at it. Do you see it that way at all?
Absolutely. We're here 24/7 for whatever your emergency may be. Everybody's definition of an emergency is slightly different. So here we are.
That's right. Let's talk a bit about, you mentioned road rage. Road rage is pretty interesting. I don't know whether it relates to, everybody blames road rage on a lot of things, but particularly you hear about alcohol and drug use. But I really think that sometimes it's the anxiety issues, oversimplistic, traffic. Sometimes it gets really definitively difficult to traverse from one side to another side we're going. But road rage is really symptomatic of someone's anxieties. And I'm just wondering, I would assume that you see what I would call the product of road rage. You see the accident victims, you see the cuts, the bruises, whatever.
The gunshot wounds.
The gunshot wounds. Well, I was going to ask you about that, but go right ahead.
No, we had a case of just that. The guy was driving down the road and somebody cut him off and he had a few words to say and the guy just pulled out a gun and shot at the car and got the patient. So he drove himself into the ER. I was shot. So again, these are very stressful months that are coming up. I think that people need to keep in perspective what it is that you're doing and give yourself time. The stress of just the traffic, if you give yourself that extra 5, 10, 15 minutes, get up a little bit earlier, it really makes a difference. I tell it and I preach it and I try to do the same thing because it really can make or break your day, whether you're running around super stressed and trying to get to the next appointment or trying to get to the next mall so you can buy the next gift or the next meal, etc.
But let me talk about travel safety, because I think a lot of people who go away during the holidays, particularly they visit family or they go on cruises or they fly across the nation to certain resort spots. What is your suggestion relative to how should they prepare themselves? Because many people are on certain regimens of prescription drugs or even diet issues, et cetera, et cetera. Let's just talk about that.
Well, the biggest thing, obviously, that's very relevant to the now is the Zika virus. So, exercising the fact that you must pack mosquito repellent now when you travel is something that we didn't necessarily have to do before, but we have to keep that in mind. But I think the biggest thing is people forget their medications. And they don't keep a list. I think it's super important and it helps us particularly in the emergency room because we don't know you, we don't have that kind of relationship as you may with your primary care doctor. It's always a good idea to carry in your wallet the names of your medications, the name of your doctors, and your medical history as well as surgical history. It just helps. It makes a big difference. Also allergies.
I think you're noticing our viewers with the fact that they should carry some medical ID with them, and certainly make a list before they go, because if you're going to whatever, even into the Caribbean, or you're going to a foreign country,
right,
or whatever, the names of the drugs are different. They might be generic names, but many of them may not be generic names. I think it's very, very important. I guess you must see that as a nurse professional, wondering, you ask questions of the patient, if the patient can be responsive to you, rather than crying or being heard or whatever. It must be very difficult.
It can be very frustrating, and just for the simple fact, it's not that we're trying to be, it's not that we're trying to interject ourselves, but there are serious adverse effects that can occur when you combine two different medications specifically, and if we don't know what the medications are, We don't want to cause harm. Most definitely, that's obviously a big concern as well. And there are certain medications that we can't give with certain conditions. So for us, it's very, very relevant that we know those things, and most definitely allergies, because we don't want to cause any type of reaction, obviously. So it's really, really important. Knowing about children's vaccines, if they come into the emergency room, those are relevant as well. And immunizations, simply a tetanus shot, especially if you're coming in with a laceration. We like those to be known, just so we know whether we need to update them or not, because that's such a simple thing to avoid if we can.
I bet there is. Doctor, it's exciting to know that people like yourself are willing to serve in the capacity of being an emergency room doctor, or emergency service physician, because the tendency is usually to find yourself into a subspecialty or an office practice, and and I say this just as an observation, the stress must be interesting. I don't want to say difficult, but interesting. You want to give me your view of this?
I love the emergency room. I only work nights, so it's particularly interesting. But it takes a special type of personality I'm not sure it's for everybody, but it's a chance to really make a difference and help people when they're acutely ill, when they have, quote unquote, an emergency. So you get to, make a difference. It's not every day that you save a life per se, but I think you're making a difference, even if it's just, fixing somebody's cold and helping them feel better. I think you're making a difference, and you're improving somebody's life, and you have the opportunity to impact their life and possibly educate them for a future event that could be avoided. So there's a lot of education that goes along with what we do as well. Oh, I rely on my nurses, because they always get the real story, and they always have that extra insight. So it's a good symbiotic relationship.
Well, that's good. We're down to the last 45 seconds of the show. I can go on and on and on, but I want to thank you both. First, I wish everybody, even though I'm not time dating the show, a wonderful holiday season. But I want to thank both of you. I think that working in an emergency room, especially here in this freestanding unit, here at Westside Freestanding Unit, in Davie at the Nova Southeastern University campus, and all of the emergency rooms throughout the state of Florida. We're blessed to have the capacity and the care of individuals like yourself that really do want to see the patients cared for, their pain mitigated, their problems solved. But I want to thank you both Dr. Vanessa Maloney. I'm sorry, Vanessa Maloney is not a doctor. She's a nurse professional, but in my mind, you're a doctor. and Dr. Carolyn Vera, who is the emergency physician and preceptor, actually, you are as well, at Westside Freestanding Emergency Room here in Davie. Thank you both very much for your service, and more importantly, for your humanity. We appreciate both of you.
Thank you.
Thank you.
Folks, I hope we spoke to you a bit about safety. I hope you take heed to what these two wonderful individuals have been saying to us. I always tell you to take good care of yourself, but really, you have to take some responsibility. Safety is responsibility. So listen to what they had to say. Take good care of yourself. And remember, this show is yours, so if you have any questions or otherwise, just give us a call. There's an email address here. We'll try to give you an answer. And remember, this show comes to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.